Good morning. This is All India Radio, Kohima. The morning news read by Jonas Yentan. 4 known frontline workers have tested positive for COVID-19 in the capital Kohima, and 3 more containment zones declared. Kohima Deputy Commissioner Gregory Techaville in a report yesterday said that of the 4 cases, 2 positive cases are from Nagabazar Colony and 1 each from D Block Colony and Lower Janmari Colony. The DC said the relevant line departments have been activated as per the incident response system. He said necessary coordinating of the area in the proximity of the epicenter has been made to contain the spread of the disease and for necessary contact tracing. The DC in an order said all movement of persons and vehicles within the defined sealed area is strictly restricted and under active surveillance with immediate effect. Nodal Officer for ITSP Dr. Nyan Kikon said all the 4 cases are part of the contact tracing of previous positive cases and still comes under local transmission. He said all the cases are asymptomatic and being treated at NHAK COVID-19 Hospital, Kohima. Dimapur Deputy Commissioner and Chairman District Disaster Management Authority Anup Kinchi has ordered the sealing of several places to take effective measures and to prevent the spread of COVID-19. The DC has ordered temporary sealing of ICU block, Eden Medical Hospital, Dimapur, ICU and Emergency Ward of Nikos Hospital, Dimapur, and Shamrock Hospital, Dimapur, with immediate effect till further order. Further, House Number 15, Ward Number 18, Zeliangrong Colony, Tobinala, and nearby buildings has also been temporarily sealed with immediate effect till further order. The district administration has also ordered immediate sealing of State Bank of India Bazaar Branch, Tobinala, Dimapur, and SBI Staff Quarter, Block C, at Bank Colony with immediate effect. The DC said persons violating these containment measures will be liable to be proceeded. The centre yesterday said that India's case fatality rate of COVID-19 fell below 2.5% for the first time. Union Health Ministry said India has one of the lowest fatality rates in the world. It said due to the focused efforts of the centre and state and union territory governments on efficient clinical management of hospitalised cases have ensured that the case fatality rate falls to 2.49%. The ministry said, with effective containment strategy, aggressive testing and standardized clinical management protocols based on holistic standard of care approach, the case fatality rate has significantly dipped. Under the guidance of the centre, the state and UT governments have ramped up the testing and hospital infrastructure by combining public and private sector efforts. Many states have conducted population surveys to map and identify the vulnerable population like the elderly, pregnant women, and those with comorbidities. Health Ministry said there are 29 states and UTs with case fatality rate lower than India average. 5 states and UTs have a 0 case fatality rate, while 14 states and UTs have a case fatality rate of less than 1%. Nagaland State Disaster Management Authority (NSDMA) and Regional Meteorological Centre Guwahati has focused heavy spells of rainfall this week over the northeast region, including Nagaland. NSDMA and Met Department in a weather update said the entire stretch of monsoon trough is shifting northward, including northeast India. Moreover, a cyclonic circulation is heading towards Bangladesh and Meghalaya. Strong monsoon activities such as incessant rains, squally weather, and lightning strikes is expected to get intense starting from today and last till Wednesday. In this regard, the public have been advised to exercise caution to avoid any eventualities during this period. Flood situation may worsen again due to the rise in the level of River Brahmaputra. NSDMA has asked all the District Disaster Management Authority and the other line departments to be prepared to attend to any emergencies during this period. The Railway Ministry has said that the private trains are slated to run from March 2023. The Ministry has issued a clarification regarding timeline of introduction of private trains, as some section of the media had mentioned that a private trains project will start in March 2024. The railway said the tenders will be finalized by March 2021 and trains will operate from March 2023. With that, we end the morning news. Have a nice day.